Medicare is a government program that began over 50 years ago to provide medical insurance to Americans over 65. It now covers around 46 million seniors and 9 million younger people with kidney disease and other disabilities. It started out with Parts A and B. These two mainly involve care when you're in a hospital and outpatient care, mostly in doctor's offices. Many people refer to these as original or traditional Medicare, and that's primarily what we'll be talking about. Everyone contributes to Part A, the hospital part, through payroll taxes, now around 3%. You could call that an insurance premium. For Part B, the outpatient part, people pay a premium, now around $130 a month, usually deducted from their Social Security checks. We won't get into Parts C and D now, other than to say that Part C, called Medicare Advantage, is run by private insurance companies and is like an HMO with limited networks of doctors and hospitals. Part D is the prescription drug plan for an extra cost. Most Medicare enrollees just participate in Parts A and B, the traditional Medicare. Despite fears that Medicare was socialized medicine, it is not. It has turned out to be a very successful and popular program. Every Medicare patient has free choice of doctors and hospital. The government does not tell doctors what to do. It has also turned out to be the most efficient insurance program in the country. The administrative overhead of private insurance companies averages around 20%. Traditional Medicare's overhead is 2 to 3% because it has one plan, one form, one set of rules, no advertising budget, no sales force, and no profits for shareholders. It just collects the money and pays the bills. Typically, Medicare pays 80% of a patient's hospital and outpatient bills. You can buy private insurance to cover the remaining 20%, called a Medigap Policy, or pay it yourself if you can. We believe that the best answer to America's healthcare challenges is to expand this popular and successful program to cover all Americans and improve it to pay 100% of all healthcare bills, eliminating deductibles and copays. In subsequent videos, we'll explain why it makes sense to do this, how it should improve the overall health of our country, and how it should save money for nearly everyone.